miss.
Welcome back from that short break, and thank you for staying with us. Now we move into today's important health discussion, one that affects many communities, and this is enteric fever, a serious bacterial infection that continues to affect many people, especially in areas of poor sanitation and unsafe water. We find that many people mistake enteric fever for ordinary fever or malaria, and leading to delayed diagnosis and improper treatment. But if not treated early and correctly, enteric fever can lead to serious complications. So today we ask, what exactly is enteric fever? How does it spread? What signs should people look for, and how can it be prevented? So to guide us through this important discussion, we have been joined by a professional, a doctor, and is going to help us understand what are the causes, the symptoms, treatment, preventions, and also the dangers of enteric fever. And this is none other than Dr. Isaac Okecho. You're most welcome, Doctor.
Thank you.
Thank you for coming.
You're welcome.
How has been your week? Because we are ending it.
We are going through a week of Ebola. Everywhere Ebola.
Yes.
So most of the people's focus are on Ebola.
Yeah.
We are forgetting other conditions that may affect us in
Okay.
the community. Actually, the most more than even Ebola.
Yeah.
Yeah, that's why I'm here today to discuss more about one of them.
Okay. Yeah, well, so you're most welcome, and thank you for coming in. And of course, not to waste any time, let's just get into it. What exactly is enteric fever?
Enteric fever is a bacterial, is a systemic bacterial infection.
Okay.
It is commonly known as typhoid in the community.
Okay.
It's called enteric fever because it is spread through fecal-oral.
Okay.
Like we get it through the mouth, and then it goes through into the guts, and it starts causing effect to the body.
Okay.
That's why it is called enteric
fever.
Yeah.
Okay. How is it even any difference from the ordinary fever or malaria? You know, people mistake these things.
Now, the difference between malaria and enteric fever is that it is very hard. It is spread through fecal-oral.
Okay.
Through these ordinary things we use, like taking raw cooked foods, salads, and then the water we use.
Okay.
If it is not boiled very well. And then it affects the guts mostly.
Okay.
It has specific organs where it affects.
The gut
Yeah,
specific.
at the start. Though later on it can spread and affect all parts of the body.
Okay.
Yeah.
So also, doctor, who is at risk of getting this enteric fever?
Yeah, mostly people at risk of getting enteric fever, we are talking about the travelers.
Okay.
Mostly. When I talk about the travelers, you get
yeah, I can understand. Those people who move a lot. Yeah.
And then also young children, because these are the group of people that can eat whatever is there.
Yes.
Whatever they find, they just take it.
Okay.
Yeah.
Also, doctor, what is the epidemiology for enteric fever? Okay, if you are to look at 10 years back and now.
The prevalence of enteric fever has been very high throughout the years.
Okay.
Because in a year, we have been losing almost 1,000 people.
Due to
in
that.
a single year due to typhoid or enteric fever.
Okay.
So that's why I decided to come and share with people about the existence of enteric fever, regardless of the period of Ebola we are going through.
Yeah.
Yeah.
Okay, so we've said it has been causing many deaths, and if you are to give difference or somehow find out, have we tried as the country, Uganda, have we tried to manage it, or or it's still increasing with these years coming in?
In the last 2 years to 3, the government has tried to fight enteric fever through awareness, teaching the community about the existence of of enteric fever
Okay.
through the VHTs in villages, and also providing medicines in those facilities in villages to reach everyone.
Okay.
So we have tried, the government has tried to fight it that way.
Okay.
Yeah.
So, okay, so what are some of the common symptoms people should watch out for this enteric fever?
So enteric fever, its symptoms has stages.
Okay.
In the first week, because it has an incubation period of 7 to 30 days.
Okay.
Incubation period, I mean, you can get a period when you start getting the signs and symptoms.
Okay, yes.
So if you get enteric fever, after a period of like 7 days, you start getting symptoms like fever of gradual onset.
Okay.
Gradual onset, I mean, step by steps, a fever of about less than 37 degrees Celsius.
Okay.
Then you start getting general body weakness.
Yes.
Yeah, muscle pains. Yeah. Then in the second week, the symptoms progress.
Okay.
We start getting abdominal pains. That's when the
germ, is it the germ?
It is a bacteria.
Okay, the bacteria is
now affecting the intestinal organs because its target is in the intestines.
Yeah.
The area called the Peyer's patches. That's where it targets mostly.
Okay.
So when it destroys the Peyer's patches,
yes,
and affecting the macrophages are the defense mechanisms of the body.
Okay.
So when they are worn out, they start causing symptoms. They affect the intestines and they start fighting the defense mechanism, and it starts causing symptoms.
Okay.
Like, for example, when it reaches the guts, destroys the guts, and it causes necrosis of the Peyer's patches, that's when we get abdominal pains.
Okay.
We get the diarrhea, and then, yeah, mostly that.
Okay. So why do you also think people highly mistake this enteric fever with these other diseases, malaria? Yes.
Yeah, most of these conditions like malaria, enteric fever, acute peptic ulcer diseases, they present the same way.
Okay.
In most cases, more so when they are just starting. They have the same presentations in most cases. More so when they are just starting.
Okay.
That's why we normally rule them out through doing further checkups. That's when we know this is enteric fever. But though it has a unique feature in it, it starts with a constipation in the first 2 weeks.
Okay.
Then later on, if it lays in the body, it progresses to the diarrhea.
Okay.
Yeah.
Also, can someone have this enteric fever without even realizing it?
Yeah, in the first actually it is common in the first week.
Okay.
You can have this bacteria into your body without realizing anything because it is asymptomatic. At some point. It starts showing symptoms, those great symptoms like abdominal pain mostly. Those are the symptoms that will take you now to the hospital.
Okay.
In the second or third week. Yeah.
Okay, so what are some of the danger signs of this infection in that it is becoming now severe?
Yeah, danger signs. These danger signs in most cases they come when you don't get treatment. If you don't get treatment for enteric fever, it can progress or cause complications in the body. For example, after this bacteria destroying the intestine, the layers of the intestines, we can get perforations. Perforations will mean these wounds the bacteria has created in the intestines.
Okay.
They can protrude through the what? Through the layers of the intestines and go to the peritoneum.
Okay.
Causing perforations. Yeah.
Okay, so doctor, we have also a condition where many people self-medicate whenever they get a fever. How dangerous is that?
Self-medication, actually, it's one of the major causes as to the major reasons as to why enteric fever is hard to treat nowadays.
Okay.
People don't get checkups, thorough checkups for it. So self-medication has caused a problem of resistance.
Okay.
People become resistant to these medications to the point that we can't even the bacteria is no longer sensitive to the medication they are taking. So it becomes recurrent.
Okay.
Yeah.
Also, doctor, can wrong treatment or delayed diagnosis make this enteric fever life-threatening?
Yeah, so much because delayed diagnosis every time you take long to diagnose the enteric fever,
yes,
it progresses in the body. Remember, the bacteria keeps on moving.
Yes, every time.
Since I said before that the bacteria affects the macrophages of the body.
Okay.
We have macrophages in every part of the body. For example, in the brain, we have the microglia. In the liver, we have the Kupffer cells. In the lungs, we have the alveolar macrophages. We have the histiocytes in the connective tissues.
Yeah.
So every time the bacteria affects those areas, it causes inflammation in those parts of the body.
Okay.
That's when we realize the person is having encephalitis. When the brain tissues are damaged, they present with, they start getting confused.
Okay.
And then if it affects the liver, they start, we get hepatitis.
Okay.
Yeah, so it progresses in that
like
way.
That.
And also so, we can get perforations. When we get perforations, it puts us at risk of surgery or acute abdomen. Yeah.
So it's a big issue.
Yeah,
there.
It's a very big issue.
Okay, so how risky is taking these the antibiotics? Remember, we talked about self-medicating. How risky is it, like, when people take the antibiotics without proper diagnosis or testing?
Taking antibiotics is okay, but I would advise you take it after seeing a doctor.
Okay.
To advise you on which medication is the best.
Okay.
And after doing some tests like culture and serological tests for the fever.
So what do you think on these people who like just go to the pharmacist and they because they have it, the vaccine the medicine worked for them a previous time when they had this enteric fever. Now they think when they take it again, it's something that is going to work out for them. What's your take on that?
Yeah, so like I've said before, self-medication is okay because the chance is 50-50.
Okay.
You may go to the pharmacy, you get the medicine, by chance you get healed. But again, there are also chances of getting the medication that is now resistant, that the bacteria is resistant to. Yeah, so for that case, we shall not be helped, and the bacteria will be progressing. Like, for example, it goes to the bile, the gallbladder. The moment it starts multiplying there, you become a carrier. So that means once you become a carrier, those antibiotics will not be of help to you.
Okay. So are we seeing increasing antibiotic resistance in enteric fever cases nowadays?
So much. Actually, that's the major cause as to why enteric fever is becoming too much in the community.
Okay.
Yeah. We are getting a lot of resistance because people are doing self-medication.
Okay. So, doctor, let's also talk about poor hygiene habits at home, silently spreading this infection within families.
So, did we talk about how the bacteria is spread?
Not yet, but we are getting there.
We are getting there. What was the question?
Okay, the poor hygiene habits at home, silently like spreading this virus within families.
Yeah, basically, poor sanitation is the major cause. Actually, it's the major cause. The reason as to why this bacteria is too much in community. Poor sanitation is one of them.
Okay.
Yeah, mostly through. Since we say this bacteria survives in water, and also sewage, sewage. So if the sanitation is not all that good, this bacteria can survive in that water, and we can get it through contact with that water.
Okay. Or even so, we find that some people recover then after they fall sick again. What's your take on that? Of this enteric fever coming back
without getting medication?
Okay, like you get medication, you treat it and it's gone, and then it comes back.
The treatment for enteric fever is supposed to take 14 days.
Okay.
But now you can take your treatment for like 2 days or 5 days. The symptoms disappear. Okay. But ideally, the bacteria will be still in the blood. So after taking your medication, the symptoms disappear. Later on, they will manifest again.
Okay.
Yeah, that's why you get healed for some time, then later it manifests.
Okay, so doctor, let's get into the stages. You said how it is transmitted. Yes.
How it is transmitted. So, like I said before, it is spread through. In English, in science, we call it fecal-oral.
Okay.
That means we just ingest it. So after ingesting it, it goes into the stomach, specifically the intestines, because it targets the Peyer's patches in the intestines.
Okay.
Those are like the the security of the body.
Okay.
So when they enter the Peyer's patches, they start destroying it. The unique thing with this bacteria it's called Salmonella typhi. The unique thing about it uses the body's defense mechanism to cause disease in the body. So when it enters the Peyer's patches, it uses the macrophages themselves to cause diseases. So after binding the macrophages of different parts of the body, they use the macrophages to go to different parts of the body. So when they reach different parts of the body, the macrophages burst. When they burst, they release the in English we call them the immune what? I'm forgetting the term. After releasing those substances, those are the ones that are going to affect the body and cause disease in the whole parts of the body. By causing inflammation, like I said, in the brain, the microglia, in the liver, the Kupffer cells.
So, doctor, moving on, how is it even diagnosed properly in hospitals?
Yeah, in the hospital, in most cases, when you come to the facility, what we do, we take your blood. For the start, we can do a serological test. We test the antibodies in the blood. But later on, after the treatment, like for example, you get the treatment, then again it comes back, we do culture. We can take your stool, we culture the stool, or we take your blood, we culture the blood. Yeah, that's how we diagnose it.
Also, what is the correct treatment approach?
The treatment approach?
Yes, for this enteric fever.
Enteric fever, in most cases, we use antibiotics. We take the medication for a period of at least 10 days, but ideally we are supposed to take for 14 days. Yeah. So I would advise, if we are getting treatment, we always visit doctors first. They guide us on which antibiotics we are supposed to take.
So specifically, antibiotics is the treatment. For this enteric fever.
Basically. But if at later stages, after this bacteria affecting the other parts of the body, like the brain and the liver, we can add in some steroids for the inflammation, because I said when they reach there, they cause inflammation. So we have to add in steroids. Those are anti-inflammatories, so they can help us on the inflammation caused by the bacteria.
So doctor, also, how important is it to complete the medication if at all you prescribe it to a patient? How important is that?
We've talked about resistance before. Every time you take treatment and you don't complete it, you treat the symptoms.
You don't treat the
so completing the treatment is going to help us it will take away the symptoms, but later on it will eradicate the bacteria from the blood totally. So there we shall not have chances of recurrence. So what are some of the preventative measures families or people should highly prioritize in order to cope up with this enteric fever? One of the preventive measures, we have good personal hygiene. Like we have to clean the environment around us. Since we say the bacteria survives in water, so that stagnant water around us, we have to clear everywhere. And then also early diagnosis. Once you get some symptoms you don't understand, it's better you go to the hospital, they do some checkups. And also getting treatment, complete the treatment once you're diagnosed to prevent you from becoming a carrier. Because once you become a carrier, you'll be the one spreading to the rest
of the people. Also, how can vaccination help prevent this enteric fever?
Vaccination? Currently in Uganda.
Do we even have a vaccine for enteric fever?
In Uganda, I haven't heard about it, but it is there. It is called typhoid conjugate vaccine. But currently we don't have it, I'm sure.
In the country?
In the country.
But it's outside?
But it is there.
So why do you think this vaccine is highly common in our communities today? Most especially in people living in urban centers, urban slums? Why do you think? No, the disease, the enteric fever, yes.
It is common in urban areas. One of the ways of this bacteria can be spread is through taking this street food. In urban, we take a lot of street food nowadays, and like we say, this bacteria is always in the environment. So it can be spread through getting these street foods mostly, where we are getting them from.
Okay.
That's the only way, that's the major way it is spread in urban areas.
Okay, so also what role does sanitation play and clean water access play in this disease?
Like I said, you said water?
Yeah, no, sanitation and also clean water access.
Yeah. So like I said, this bacteria survives in water for long, and in the environment it can stay anywhere for weeks.
Okay.
So maintaining good sanitation, it will help us stop destruct the habitat of this bacteria.
Okay.
Yeah.
Okay, so also, doctor, from your experience, what is the biggest mistake people actually make when dealing with this enteric fever?
The biggest mistake people make is doing self-medication, like getting treatment without doing checkup. And also getting treatment, failure to complete the treatment.
Okay.
Yeah, like you take some medication, you feel the symptoms have disappeared, you stop there. Actually, that's the worst mistake, and is the reason for the recurrence of the enteric fever.
Okay.
Yeah.
Also, is there any one myth you would like to correct about enteric fever today here on TV1?
Yeah, the myth I would like to correct is about the diagnosis of enteric fever. The gold standard, ideally, we are supposed to use culture.
Okay.
Yeah, we have to culture this bacteria to get to know that it's the exact bacteria we are dealing with.
Okay.
Though most facilities use serological test, yeah, that one in most cases it can give us a false positive.
Okay.
And then we mistake the bacteria to be Salmonella, yet it is not the one.
It is not the one.
Exactly.
Oh, thank you very much, doctor. This has been a very good interesting topic. But as we are winding up with today's show, what message do you want to carry to every listener watching you to remember today about this deadly disease?
My advice to the people, we should learn the measures of preventing this enteric fever.
Okay.
Like we've talked about the good hygiene, visiting hospitals for the checkups.
Yes.
And also, if we are on treatment, finishing the treatment, like completing the doses.
Okay.
Yeah, basically that.
Okay. Okay, to our dear listeners and viewers, thank you for staying with us. We have had a very wonderful discussion about enteric fever. Now, doctor, our dear viewers would like to know where you're coming from.
Where I'm coming from?
Yes, how can they reach you? Because people have many questions about enteric fever, and because of time, we are not going to go there as any cause. But then, if at all they want to talk to you more and you help them treat this disease, where can they get you from? And also, if you would send greetings to 1 or 2 or 3 people watching you, then we can call it a day.
Okay.
Yes.
Those who would want to get me, I work with Praise God Clinic. I know the staff is there watching.
Okay.
Because they called me before.
Thank you for watching. Praise staff.
I work with Praise God Clinic. It is in
Praise
Zambia.
God.
Yeah, Praise God Clinic in Zambia.
Yes.
Just behind Zambia Hospital.
Okay.
Yeah. If at all you would like to get me, I'm always there. You reach there, you ask them, Dr. Isaac.
Okay.
We shall be sharing more.
Okay.
And also, I want to send greetings to my mom. I know she's also watching.
Hi.
Yeah, she told me I want to see you today.
Okay.
So, and also my sisters and everyone, friends.
Okay.
Yeah.
Thank you very much, doctor. And to our dear viewers, thank you for staying with us since where we started this show up to now. We are ending it. We've seen that enteric fever is preventable, treatable, and also measurable, but only with proper awareness. Hygiene and timely medication can help cope up with it. So thank you for tuning in. Let's meet again next week. Still your house show from 4 to 5, and may God bless you and have a blessed week.